Awesome. Hey everyone, welcome back to another session with Fresh Dental Shadowing. Today we have a very special guest, Dr. Samuel Thacher, and he is going to be giving us a glimpse into sports dentistry. I know personally I am so excited and I couldn't wait for the session. I know you guys have been asking about sports dentistry and wanted to know. So thank you so much, Dr. Thacher, for coming, and whenever you're ready, you can take it away.
Great. Well, thanks for having me. I mean, it's an honor to be here. I know that when I was in school, I didn't even, I'm imagining there's a lot of people out there that probably aren't even necessarily locked into dentistry as a career choice. And I know I wasn't when I was in college, and it really wasn't until I shadowed at a dental office myself when I kind of made the decision. And I know it's next to impossible to do that right now. So this is a great opportunity for college students. So thank you guys for doing this. This is great. Okay, so yeah, we'll talk a little bit about sports dentistry. I should probably mention I don't really give a lot of lectures or presentations. Like I'm not on the lecture circuit. I really haven't given many presentations at all. I've given a couple. I gave a couple at UC Berkeley to pre-dental students a couple of years ago, but I would probably categorize those presentations as like really boring or maybe even terrible. So I kind of wanted to make something a little bit more entertaining today. So hopefully this is. But we'll kind of talk a little bit about, I'll list some things we'll touch on today. Talk about me very briefly. We'll just kind of hit on that a little bit. We'll talk about the prevention of sports injuries. I know you have to take a multiple choice test after this is over. I may have some insight onto what the questions might be, and so if I see something that might be on the quiz, I might pause for a minute and maybe highlight it. So I was never a fan of teachers that would kind of bury multiple choice questions in the text. We'll talk a little bit about what it means to be a team dentist in relation to sports dentistry. And then we'll look at several sports dental injury cases. I've got some videos I'll try to play. Hopefully it works out. We'll talk. I'll put some graphics up there, and we'll go over some terminology. And I'll mention also the Academy for Sports Dentistry, and I'll give a little link to their information because they're pretty much the only authority on sports dentistry in terms of like an organized group. There might be a few others, but they've been around for the longest. I've been a member since 2011, and so in terms of resources, they are about the best thing out there. And I also have a little story about the Giants that I will share if we have time. And maybe if we have time, I can also talk about just a couple of things, maybe non-sports, more kind of like just private practice related from me. Okay, well, let's get into it here. So that image right here is from, this image is from, let me get a pointer up here. This is from a magazine that UOP puts out every quarter, I think. And so this was an article they did about sports dentistry and highlighted some of their alumni that are working with some of the teams in the Bay Area, in the San Francisco Bay Area. And here's my picture. We took this over at Oracle Park, which is where the Giants play. And it's literally, I don't know, 50 yards, 100 yards behind me. I could grab the computer, we could go outside and look at it, but I'd probably lose the Wi-Fi. But it took them about 2 hours to get this picture. Like, when we got there, the idea was I was going to hold a bat or throw a ball, but I think we tried that and maybe it looked a little bit too uncoordinated. And so we settled on this one. But I'll kind of be referring back to this article a few times as we go through. So I'm 48. So a lot of my stories probably aren't necessarily as relevant to you as some of the other speakers have been here before. So I won't talk too much about dental school and my experience in dental school. I'll talk about it a little bit right here, but just let's touch on it. I moved up. I grew up in Monterey. I moved up to Berkeley in 1991 when I started undergrad. and I graduated in 95. I took a year off before dental school. And the idea there was that I was going to take a year off and work and then study for the DAT. But what I found, I mean, I had a full-time job. I was in kind of the, biotech sector or pharmaceutical sector actually, for a year. But with a full-time job, I mean, I probably had less time to study for the DAT than I would have had I been in college. So if you're planning on taking a year off between college and dental school, I mean, I'm not saying don't do it. It might be a great idea just to kind of, relax from school a little bit. But if you plan on working, it does take up a lot of time, and usually kind of burns you out. When you start working 40-hour weeks right out of college, that's a big adjustment you have to make. So that's just one thing I might mention. Yeah, I've been in private practice for 20 years right here. I'm in my office right now. I'm the only dentist here. I love my office. I'm the only dentist here. I have one hygienist. I've got one assistant. We have my wife manages the practice, and then we also have someone who works up front, kind of is kind of a front office administrator, and that's really all we are. And that's kind of all it's been for 20 years. And I really can't. I've never really wanted to expand. I never wanted to kind of really grow my practice to where I was bringing in associates, opening up another location. That never really appealed to me. I know it is a strategy among a lot of dentists, but we love kind of the close knit situation we have here. I'm in San Francisco. We're kind of in the South Beach, Mission Bay area of San Francisco, which is pretty much downtown, but it's kind of in a newer area of downtown that's still being developed. And so we get a lot of people here that are in tech. A lot of our patients are in tech. And then also a lot of people who live in the area in condos and apartments around here. So our patients have been great. They've been great for, during the whole COVID thing. We have a lot of stuff in place, safety measures in place, and they've been really compliant, and it's really gone really smoothly. So I've been the team dentist for the Giants since 2013. Let's see here. And I also work a little bit with the Warriors since they've moved over here. They were in the Oakland, Alameda area, which is in the East Bay of San Francisco, for 30 years, 40 years maybe. But they just moved over, and their office, their Chase Arena is very close to where I am as well. And so I know Dr. Todd, who is the team dentist for the Warriors, and he and I reached out to him, and so I've helped out a little bit with the Warriors as well. I do a little bit of stuff with the Olympics, help out with some of the college athletes who are swimmers, and so that's another thing I've kind of done as kind of doing sports dentistry. All right, and I'm married, and I have 3 kids too. I think one of my kids is actually here. It's my
party people.
It's my daughter Audrey. She's going to kind of help me out with any tech support on my end, which undoubtedly I will have some problems. So if there are any issues, you blame it on her.
Nope, not my fault.
Okay, fair enough. All right, so let's look at just basic definition, sports dentistry. So sports medicine encompasses a lot of things. Like a team was going to have, they're going to have a general, MD. They're going to have a orthopedist. They're going to have nutritionists. They're going to have physical therapists, and dentistry fits into that as well. But basically, with this slide, the key point here is the key word here is prevention. And sports dentistry is really, it's the branch of sports medicine that deals with the prevention of dental injuries, and that's kind of prevention really is the key word here. We spend a lot of time talking about this when I'm doing CE in sports dentistry, and in terms of prevention and dental injuries in sports, that really kind of boils down to kind of one main factor, and what that is mouthguards. And we spend a lot of time talking about mouthguard design, and different types of mouth guards for different sports. And this actually, this mouth guard right here, this actually is not an ideal mouth guard. And we'll kind of go into a little bit about what a properly fitted mouth guard entails. And I'll show you some examples here. So basically, if you're an athlete, whether it's football, whether it's volleyball, soccer, a mouth guard is always a great idea. But they're not all created equally. Ideally, you're working with a dentist when you get your mouth guard made, and it really needs to cover basically the biting surfaces and the soft tissues around the teeth, not just the bottoms or the biting surfaces of the teeth. And in order for a proper one to be made, it really needs to be made on a stone model, which means you need to take impressions or molds on a patient. And the key point here really is that it's the thickness of the mouth guard. And so on the biting surfaces, and I'm talking on the back teeth and on the front teeth, the mouth guard itself, to be effective, needs to be at least 3 millimeters thick. And if you were, I don't know, taking a test on this stuff, that might be a number you might want to remember. But not just the biting surfaces, but also that's what occlusal means. Occlusal means the biting surfaces of the teeth. The labial area is right here. And it's the front teeth. And those are the teeth really that receive the most force and are actually injured the most frequently in sports. So 3 millimeters on the biting surface and 3 millimeters on the labial surface of the teeth in the front. So we can look at a couple examples of mouth guards. So knowing what you kind of know in that last slide, does this look like it's a properly fitted mouth guard? No, I mean, you can see right here, right off the bat, like it's not, there's a hole in it. So, that's not 3 millimeters thick right there. It looks a little short on this side, like it's not covering the tissue. And I mean, actually dogs love these things. So if you leave it out lying around, dogs are gonna grab it and they're gonna chew it up instantly. And this is kind of what it looks like happened to this one here. What about this one? No, not even close. This is what's called a boil and bite mouth guard, where you bite over the counter. You put it in boiling water and you bite into it to kind of shape your bite. But it doesn't even look like this one. They even did that with this one. And eventually just kind of like chewed through it. So this is not an ideal mouth guard either. Actually, it's pretty disgusting, if you ask me. So the question is, how do you actually make a properly fitted? Is this the graph? Are we going with these graphics here? Is that the?
Actually, I didn't make this.
All right, I guess I made these slides anyway. Okay, so in terms of making a mouth guard, we've got this is called the Drufer mat. This is a pressure forming laminating machine, which is used. So basically, the idea here is that you've got what I'm circling right here is a stone model of someone's teeth, and these discs, these are plastic discs, these are that are heated, and it's dropped over the impression, and its pressure kind of forms against the surface of this model, and you end up with something that looks like this. And when you look at the term laminated, what that means is that you've got this clear material, say, is on the inside, and this blue material is on the outside. So this is actually this is 2 layers right here. And here's another example right here. And this is one where you had kind of a specially, say, colored disc, or maybe you had kind of scraps from 3 different discs that you used and you put them together. But in any case, using a machine like this, the Drufer mat, the fact that it uses pressure to kind of create the guard will ensure that it's leaving adequate thickness on the teeth, and it doesn't really thin out the mouth guard on the biting surfaces of the teeth, and that is the key here. So the key with this machine is that it makes mouth guards that are thick enough, and that thickness is 3 millimeters, 3 to 5 millimeters depending on the sport. Some of the sports that require bigger, thicker mouth guards might be something like boxing or MMA fighting. Those are the ones. Those are the really big mouth guards that are, say, like 5 millimeters thick. Let's see here. Here's a cross section of a front. This is on a stone model, and this is the cross section of a front tooth and the guard itself, and it's showing you the thickness of the guard right there. You can see it's fairly thick right there. And here's the labial, the front region too. Here's Steph Curry's mouth guard. Dr. Todd, who is the Warriors dentist, made this guard. He brought over all the Warriors mouth guards to me to bring over to, so I actually got to deliver the mouth guards. I didn't make them. But as soon as he brought them over to me, I dug through and pulled out Steph Curry's and took a picture of it. Because, one of the indelible images in the NBA is Steph Curry walking around with his mouth guard hanging out of his mouth. Now, you look at his mouth guard, it probably isn't 3 millimeters thick. It's just kind of a comfort thing for him. It's kind of his preference, and I don't think anyone's going to tell him he needs to change his mouth guard. All right. So let's see here. We can kind of get into team dentistry a little bit here. Let's see. So this is another picture from that the UOP article. These are all UOP alums that are in the Bay Area. Here's myself with the Giants. So, I mean, if you look at this, you've got someone with the Sharks, with the Warriors, and the 49ers. Like, I'm probably the third, maybe even the fourth choice for you guys that would want to speak in terms of interest. No, I'm just kind of making fun. But we'll touch on a few of these guys here, and because some of the stories that I have to show you are from them. But this is in Arizona. So every year with the Giants, we go down to Scottsdale, Arizona, actually right around this time. We didn't go this year just because of everything that's going on, but we've gone the last 2 years. And essentially what happens is in spring training, when all the players arrive and before they start games, as the team dentist for the Giants, it's my job to do exams on everybody, kind of these preseason dental exams, oral cancer screenings, to make sure that we're not seeing anything suspicious. And so they're set up in Scottsdale, like downtown Scottsdale. And what that means is that if there are any problems, we can refer them out just kind of right there. If we see anything that is like a big dental issue, and we see them, like if somebody has a bombed out tooth, like a wisdom tooth that needs to get pulled out, there are surgeons in Scottsdale that we work with that we can get them to. If there's little things that are going on, we just notate it. And then when they get back to San Francisco during the season, I'll take care of it during the season. You see them in the office here. And here we are working. This is the first day. The first day is always the business, always the busiest. They usually run through about 70 players. It's not just the major league roster that is there when the regular season begins. It's everyone who's invited to spring training. So we see a ton of pitchers and catchers right at the very first day that we arrive. And then as the players start to come in, we'll see them as well. And it usually takes a couple of days. And then my other job as the team dentist is really kind of to be on standby during the regular season, because I'm back up here in San Francisco. And when the team arrives back up here, they'll call me if there's something going on. I don't need to attend the games. That's not a requirement in Major League Baseball. It is a requirement in hockey. It's a requirement in the NBA. So I've gone to 10 or 12. I went to about 10 or 12 Warriors games last year because there has to be a dentist covering the games at those particular games. Football, I'm assuming as well. I'm not 100% sure. So just, I mean, if I'll make this is a quick slide just to talk about team dentistry. If there are people out there that are interested in working with a team, and not even necessarily a pro team, but if you like sports and you want to do something related to sports and dentistry, which is a nice thing. I mean, if you're a big sports fan and you want to combine your career with that, team dentistry is really an awesome way to do it. It's not necessarily, I mean, it's I guess how would you say it's different from sports dentistry? I mean, in your practice, you can offer sports dentistry services, which amounts to, mouth guards, treating sports injuries. But if you're a team dentist, what that means is that you're kind of giving your services to like a team or a club or even a school. And like I said, obviously helps if you're a fan. If you're not really a fan of sports, then this may not necessarily be something that you would want to focus on, because it isn't something necessarily at any level that you're really getting paid for. It's something that you want to do because you love doing it. I grew up a Giants fan. It was funny. The story there is, and how I became the Giants dentist was that, I'm so close to the ballpark, and that literally was intentional. I mean, I went to dental school at UOP, and so we settled in San Francisco, and I went to open my practice, and this area down here really wasn't built up very much, and so I thought it'd be great to be next to where the Giants were, because the Giants had opened up their ballpark here in 2000, and we moved in 2003 or 2002, and I had patients that worked for the Giants because their ballpark's right here, so we would see like admin staff that would come in, and if somebody asked me, like, they said, "Hey, are you the Giants dentist?" And I said, "I don't even know what that means." Like no, but tell me more. And so I kind of started investigating that a little bit, and it turned out there was a dentist for the Giants, and I didn't even know that was really a thing. And believe it or not, the dentist for the Giants, his name was Les Plack. And this is he was the dentist for the Giants from about 2000 until 2013. And so basically the story was, I contacted him and I said, "Hey, how did you do this? I'd love to hear about this and help out." And fortunately, he was just incredible. He kind of mentored me and introduced me to the Academy for Sports Dentistry, and we went to some CE courses together. And about 2012, he started thinking about retirement, and then what he did is he talked to the trainers and said that he recommended me to take over, and that's really all it was. I mean, it was several years of kind of persistence and kind of keeping with this, because I really wanted to do it, and it just worked out. These kind of professional jobs aren't necessarily, they don't come across that often, obviously, as you can imagine. But I mean, if you're in a city where there's a pro team and you want to do it, I mean, the idea there is you can, in this case, I reached out to the dentist who was there and just kind of, showed my interest. But if you are from a town where there is not a pro team, and you probably have high schools that are there, community colleges, and this is actually, there's different benefits to this, and actually some of them are even more rewarding, because if you were to say approach an athletic director at a community college, or I don't even like a coach of your kid's soccer team, say, "Hey, how about I just make mouth guards for everybody on the team, and then I can kind of I can be on standby and help out with if anything happens, any of the players, any emergencies, I'm happy to help out." And so in a small town like that, or it doesn't have to be a small town, but I mean, obviously the benefit from there is that you're kind of working with the team, you're kind of building community. And the key here, though, is that this can really build your practice, because if you're, say, the team dentist for your child's soccer team or volleyball team, and you make them a mouth guard, it's going to get around, like the parents are going to ask about it. They're going to wonder what's going on. And so they're going to, inevitably you're going to kind of, your practice is going to grow because of this. So getting involved, and that's, probably more applicable in the high school and below age level, is what I would say. But yeah, huge benefits there. And I kind of talked a little bit about what's going on in pro sports, or even NC2A Division One. I have a couple of friends. I have a friend who's one of the dentists over at UC Berkeley, and they have 3 dentists there because I mean, there's about 25 different teams. But I mean, that's a whole different set of benefits there. I mean, again, you're probably not making money when you're doing it. But the trade-off is that you kind of get, you're kind of hanging around these athletes. You can go to games, if you want to, you can be on the field. One of the things that's a little bit disappointing, I'll just mention this, is on the pro level and maybe even on the college level, the trend now is these pro teams, if you're the team dentist, you can be the team dentist, but they're starting to charge you a marketing fee to be the team dentist. In other words, it's like obviously being a team dentist for like the Dallas Cowboys is a very, that's something that a lot of people want to do. And so because of that, they'll say, okay, yeah, well, you can be the team dentist for the Cowboys, but it's going to cost you $30,000 a year. So effectively you're advertising with them, and they call it like pay to play, basically, where you're advertising with them to be the team dentist. And that is a trend that is happening in some sports, which is kind of a bummer. It kind of happened to a woman I know who was, I won't mention the team, but she was a team dentist for a team in the NFL for a number of years, and they just kind of dropped that bill on her desk, basically. And so she left. Fortunately, that's not happening out here, but you never know. But we'll get into some cases here. This is Dr. Todd. He's a Warriors dentist. He went to UOP. He graduated a few years before I did. And so his big joke here is that it's up here, is that one of Steph Curry's mouth guards sold on eBay for $3,000. And I guess one of the times when Steph was in his office for an exam or cleaning or something, he said, well, maybe I should just retire. We can just make a bunch of my mouth guards and we can just sell them on eBay and just make our money that way. But we can get into, let me see, I have some videos here. We'll see how this works out. I'm going to try to play this and I'll see what happens. This is the Warriors against the Bulls a couple years ago. I'll just play part of this video. Oops, hang on.
Stolen. Nope. And Dunn's got a freebie. And you've got a 5-point game. Chicago will use the timeout as Chris Dunn is hurt.
And we'll have slow motion here.
You can see that. The game. Dunn goes down with.
Clay didn't see him. He got taken from the side, but no one. Dunn did this all himself.
No.
Oh my goodness.
Oh no.
Oh man.
Ow. To protect himself.
And if you wonder why you don't put your arms out, try to break your fall, it's still precarious.
So the deal there is, here, let me go to the next slide so you can see what happened. So the deal there is that was really not quite as bad as it looked on the video. It was a chipped tooth, and I think one of the teeth kind of got shoved back in his mouth, and they were able to fix it fairly readily. But this is the floor, and so you're looking at an NBA hard maple wood floor with kind of several layers of some sort of laminate coating on top of here, and this tooth kind of cut through all of that. And so I can tell you basically, it's like landing on his face. He basically landed on his tooth, and to kind of come away with being able to get up and walk away from that is pretty good. Now there's a couple other cases here that aren't quite as nice as this one. Kobe Bryant. So the team dentist for the Lakers, I've met him a couple of times. His name is Jeff Hoy. He might have retired by now, but at these symposiums for the Sports Dentistry Academy, he tells his story, and he's got a way better video than I have, and I think I don't know how he has it, and I couldn't find it, but I have some video of this, and I'll show it to you. but there's a story that goes along with this video, and I'll pause in the middle of the video, and we will I'll tell you the story. The video it's from like 2002, so the quality is a little bit iffy. But let's see here. I need to fast forward to about here, maybe. The deal is, it's the Lakers and the Warriors. It's tied. This is a regular season game, but tied with about 4 seconds left in the game. The Warriors just hit a big three-pointer, and the Lakers are going to try to run one last play to try to win it before it goes into overtime. So I'll pause it here.
Poor defense by the Lakers. The Warriors got not one but two good looks at a three. The offensive rebound against two hurts the Lakers.
Rick Fox, Derek Fisher, and Brian Shaw have to make it happen.
Okay, so Lakers are running a play. Here's Kobe Bryant down here. They're going to try to get the ball down to Kobe Bryant, and you'll see what happens.
He's got it, looking for Kobe. Fox on the backdoor cut. Lots of contact. The ball is lost out of bounds.
There was a collision.
Yeah, Antoine Jameson and Kobe Bryant. Backdoor cut by Kobe. Rick Fox was trying to set a screen. Obviously, the Warriors were trying to break up that configuration as we take another look.
Okay, so here's Kobe Bryant again right here. And this is in slow motion. You'll see kind of what happens.
A back screen, I mean a big-time collision.
The game tonight, you see the small knot. Guess it's small if it's on somebody else's forehead above Antoine Jameson. Murphy.
Okay, so here's the story real quick. So Antoine Jameson was on the Warriors. The back of his head hit Kobe Bryant's face, and Kobe Bryant's two front teeth were shoved into his mouth. Like, I mean, they didn't fall out or break, but they were shoved straight in. And so, and kind of locked in place. And so he goes over to the bench, and the team trainer is trying to figure out, okay, what are you supposed to do here? The team dentist, who was also at the game, Dr. Hoy, is kind of motioning to him, saying, like, go back and, just grab his teeth and move them into place. And the trainer's like, I'm not doing that. You do it. And so Dr. Hoy runs down. This is all on his video too. It's really a bummer. I can't find it. But so he reaches over, and he's kind of behind the bench, and he reaches, puts a glove on, and he reaches into Kobe's mouth and grabs his teeth and just snaps his teeth back in place. And literally, they put Kobe's mouth guard back in, and he goes back on the floor. And I mean, he had like a couple buckets in the overtime, and the Lakers won. And it's, it tells you kind of what a kind of competitor Kobe Bryant was. Let me get out of this. But we can talk a little bit about this, like what happened in this case. 1 second here. This is not Kobe Bryant's mouth, but this is a situation. This is where two teeth are luxated, basically pushed back in the mouth. And this is a similar kind of injury. Kobe's were his two front teeth. This is a central incisor and a lateral incisor in this case. Let me see here 1 second. So what lateral luxation means really is that it looks like the tooth is basically shoved back or pushed towards the palate in the mouth. And what accompanies that is this fracture of the bone. This is called alveolar bone, and it's usually thin right in the front. And a lot of times that breaks, but the tooth doesn't break. The tooth is usually intact. But the tooth it's kind of locked in place. As you can see, the end of this root is kind of stuck underneath this bit of bone. And so if you don't know this and you're trying to move the teeth back, you're going to be kind of pushing on the teeth, and it's just going to be stuck in that position. And that's why Dr. Hoy went in there and grabbed him, pulled them down, and then shoved them back and kind of popped them back into place. And I've had to do this a couple times in my practice with emergencies, and just in both cases were actually somebody on a bike. And one time it was right in front of my office. Somebody was on a bike and a car door opened, and they got hit, and they went face first into the ground, and they walked right in, and we did it. But in this case, typically what has to happen is you put the teeth back in position. You have to hold it in place with a splint. A splint can be a number of different you can do that a number of different ways. It can be something as simple as like a orthodontic wire that is kind of bonded to the front of several teeth to hold those teeth in place. And generally, you have to end up doing a root canal on the tooth that has been luxated. And why do you think you have to do a root canal? If you look at this picture, it should tell you the answer, because the nerve and blood supply to the tooth has basically been severed right here. It's been cleaved by this bone when it got shoved forward. So even if you put it back in place, typically it's not going to reattach. This tooth is effectively going to be dead pretty quickly. But that doesn't mean you have to take it out. I mean, if you put it back into place, do the root canals, probably do some kind of crown on the tooth or veneer, then you're probably going to be in pretty good shape. And this picture is, I don't know, maybe 2010, 2009. But these are either, I can't remember what Dr. Hoy said. These are either full, like full crowns, or there's kind of very heavy veneers on his teeth. But they look pretty good. We'll go forward here a little bit. How are we doing on time? How are we doing on time?
I don't know.
Great. All right. So let's see. My friend Xavier Gutierrez is one of the team dentists for Fresno State. And they a big program here in Fresno, California. And their softball team generally competes every year for at least kind of the Mountain West Championship. But I have a video here we can look at. Hopefully this plays.
Heading into Friday's NCAA Regional, the Fresno State softball team is breathing a sigh of relief for two reasons. One, finals are over, and secondly, Brooke Ortiz is returning to the lineup after a devastating injury in the WAC tournament.
Hang on.
Friday's NCAA Regional, the Fresno State softball team is breathing a sigh of relief for two reasons. One, finals are over, and secondly, Brooke Ortiz is returning to the lineup after a devastating injury in the WAC tournament. The Bulldogs freshman second baseman.
Yeah, so basically she was playing second base. She got hit in the face with the ball. I think she turned her head for a split second, and so basically she just caught a softball with her face. And here she is being taken off the field. And it's kind of a similar injury that with what happened to Kobe Bryant. So this is a front central tooth, a lateral incisor here, and one of her canines. And these were all kind of punched back. This from a softball. You can see there's a little laceration on her lip. And here she is kind of at rest, and you can see how far back these teeth are. But they were able to, well, actually, here's a panoramic x-ray. This x-ray is after the teeth were kind of placed back in their sockets properly. But if you look at this x-ray, you can see, if you look at kind of like the symmetry down the middle of her mouth here, you can see there is asymmetry right here. These teeth seem to be kind of off kilter a little bit when you look at this side. But this is a great shot of the splint where Xavier was able to put the splint in place to kind of hold the teeth as well as he could, because basically you're just kind of winging it here. You're trying to put the teeth back into the right position and just lock them into place, and hope you account for the bite and hope it works. But here she is afterwards. This is, I think it's several weeks afterwards, but you can tell that there's a little bit of a cant to her mandible, to her jaw here, when compared to her face. And if you look at her bite, she's biting down on only like her front teeth, just on her left side. So in this case, what you're going to want to do is you got to move the teeth orthodontically, either with braces or with Invisalign. But this is one other term I might bring up. when you have injured teeth and teeth that are moved that aggressively, you run the risk of those teeth fusing to the bone. And I'm just going to show you, this is a slide here to kind of demonstrate what this is. This isn't an injury. This is a baby tooth right here. This is a primary tooth, and this is an adult tooth. But this baby tooth, this baby tooth is retained because this person is missing a permanent tooth underneath it. So this person never lost this tooth. What happens with baby teeth in this situation a lot of times is the roots will fuse to the bone, and that's called ankylosis. All right. Pop up on the quiz. And just if you look at the roots of this tooth compared with the roots of this tooth, you see a space here. This is called a periodontal ligament. And this is the space, kind of acts as almost like a shock absorber for other teeth. But this one, it's been there so long, the roots have basically fused the bone. And I bring it up only because when you injure a tooth that dramatically, where it's displaced like that, this process can happen. And so if you don't move the teeth orthodontically soon enough and the teeth fuse to the bone, you're never going to be able to move them ever again. They're basically locked in. So that was just a little bit of an aside, but I just wanted to kind of tell you a little bit about what that means and how that applies here. But yeah, they were able to look at Invisalign. They didn't even have to be regular braces. They did Invisalign, and you can see her bite was great. She's great. She's a competitor, and I think she was, playing again very soon after this. So they did an outstanding job. So Dr. Nishimura, Mark, who was in my class at UOP, and he's the dentist for the San Jose Sharks. And so the Sharks, you can imagine with hockey, these guys see injuries all the time. In fact, in the NHL, you need to have a general dentist and I believe an oral surgeon at every game. And so Mark, they had to treat Logan Couture, who was a center on the Sharks. And I can show you this picture because this guy posted it on his own Instagram account. Otherwise, if there's maybe HIPAA violations, if you're trying to show pictures of people without their permission. But with respect to Mark or Dr. Nishimura, I won't talk necessarily exactly what they did in treating him, but you can kind of see here that, yeah, he's missing some teeth. And what happened here was, this is not like a hockey puck injury. This is what's called high sticking, where I'm sure people on the East Coast know what this is, but basically he got hit in the face with a hockey stick and lost a couple of teeth. And so that is a sports injury that, it's a little rarer than the luxated situation, but when you lose a tooth and it's intact, it's not broken, and the bone isn't even necessarily broken, that's called an avulsion, or that's an avulsed tooth. So you're looking here at a central incisor, a front central tooth. I'm not sure actually in this particular case. This is not his tooth. How this one came out, but this is an intact central incisor. And the idea here is that if you're a dentist on the spot for something like this, the chances of saving this kind of situation is pretty slim, but you do have a chance to basically put it back in the mouth and have it basically reintegrate and work. But there's a couple things to know here. When the tooth comes out, you've got to be really careful with it. You can't wash it off. You can't clean it off. You've really just got to put it back in. If there's no dentist right there, if this is at a basketball game, youth basketball game, there's no dentist there, and no one wants to put the tooth back in, then you can put it in something like milk or like a saline solution, and get an emergency dentist to kind of help out with the situation. And I mean, the time is, it's ticking very quickly in order to kind of, the chances of this actually being able to be reimplanted and staying in the mouth without being rejected. But The question is, why can't you put it in water? And the hint is that the root is covered with connective tissue. And if you put this in water and transport it to a dental office, what will happen is there's the cell membranes on the periodontal ligament, which is still attached to this tooth. That's what all this is right here, will burst because, basically, this is kind of a MCB. What you learn in MCB is osmosis. I mean, water is hypotonic. I mean, it's going to rush into the cells and they're going to burst. And so you might be looking at me and thinking, hey, what's this guy doing lecturing me about MCB? And, who is this idiot? And, you might be right, but that's at least that's what I know about this. So let me move towards the end here. Let's see what we have here. All right. So yeah, here's someone trying to reimplant the central incisor. If you put it back in, the patient's got to be taking antibiotics because there's going to be a high chance of infection after this. Obviously, splint the tooth, root canal, and hope it works. Okay, yeah, real quick. Okay, so this is this is the website for the Academy for Sports Dentistry on the bottom. And I've been a member here probably since 2011, I believe. And I wanted to touch on it briefly. Here's some of their literature about how to deal with dental emergencies. This is the tooth avulsion scenario. Here's the luxation scenario, and this is more like a chipped tooth here on the right. But they have some good literature on their website on how to address and treat these situations. But I was just going to touch real quick about concussions because comes up and this is such a big deal in sports now. Whether or not, as dentists, we can do anything to help prevent concussions is still under debate. There's not really enough research on that, but some of the papers that have come out are looking at the idea that a properly fitted mouth guard with proper thickness could help reduce the effects of an impact and potentially reduce the effects of a concussion. Again, there's not enough information to support that yet. But I bring it up also because at our symposium we had about 3 years ago, we had it in San Francisco. The Sports Dentistry Academy has their meetings every year in different parts of the country, and we had it in San Francisco, and I helped out, and I was able to get Dr. Omalu. We reached out to him, and I don't know if you've seen the movie Concussion with Will Smith. I don't know how old it is. It's a few years old. Where Will Smith played Dr. Omalu, and Dr. Omalu basically is, for those of you who don't know him, he did a lot of research into the effects of concussions on athletes and how it affects their brain permanently, how it affects them later in life and their health. And you see kind of the rash of say like suicides or violent behavior among retired NFL players, and they also, and all of these athletes after they passed away, they all had kind of a similar pattern in their brain tissue that he discovered, and so that basically is him highlighting the effects of concussion in sports. So he came and spoke to our group. It's a really small group, and he did it for free. He's an incredible guy, very charismatic, and just like really very inspiring. And so it was really an honor to have him come and talk about concussions. Like the world-renowned leader in concussion research. And it just so happened that my son had a concussion like the week before this symposium. This is 2017. He's now a freshman at Berkeley, but this is when he was a freshman in high school. And after the meeting with Dr. Omalu, my son was out of the hospital at that time. We had a little talk with Dr. Omalu about it, and told him our concerns, and he was just incredibly reassuring, and it was really it was really a great experience. And so that was one of the events with our symposium. Here we are, kind of a family shot here. Oh, here's Audrey.
That's awful.
were you like 7 in that picture?
I think I was 12.
12?
Yeah.
Okay. All right. I'll tell you a quick Giants story. Jake Peavy, he is retired, but he was in the Giants for a few years. He pitched for the Padres, the Red Sox, and he was on the Giants towards the end of his career. In 2014, the Giants were making a playoff run. They were in the playoffs, and they were playing the St. Louis Cardinals in the National League Championship Series, and it was in San Francisco, Game 5, and the Giants were up 3-1. If the Giants win that game, then they go on to the World Series. So that the day of the game, we get a call from Jake Peavy, and he comes into our office. He said he chipped his tooth, and so I was like, okay. So he wasn't even supposed to pitch that night. So he comes in, and it was a nothing thing. I mean, it took me 2 minutes. We didn't even have to add any composite. We just smoothed his tooth out, and he hung out for a little bit. And he was a really nice guy. He's a really intense guy, but he's really nice. And then he left. That was it. So maybe like an hour later, I got a phone call, a text from a few people who were telling me that, hey, did you just see Jake Peavy in your office? I said, yeah. How do you know? He said, well, this tweet came out from this sports writer, Hank Schulman. He's a Bay Area sports writer. And somehow this was a scoop, apparently, that Jake Peavy needed to go to the dentist. And then this is the day of the game. And so then it's picked up by a couple different news agencies. NBC Sports even reported this. And it's really bizarre because he wasn't even supposed to pitch in the game. But regardless, it was in the news. So I got more and more texts from people and like phone calls and, hey, Jake Peavy. I said, well, yeah, I mean, okay, it wasn't that big of a deal. So fast forward to the game that night. It's again, if the Giants win this game, they win the pennant and they get to go to the World Series. And I'll see if I can control this, but let's see here. This is what happens.
Travis Ishikawa hits one into right. The Giants win the pennant.
Okay, so what you're seeing here, the Giants win the game on this 3-run homer by Travis Ishikawa, but as he's coming around second base, Jake Peavy runs out onto the field and tries to grab Travis Ishikawa, and Ishikawa is telling him, no, don't touch me. See, there's a rule in baseball. It's kind of loose, but basically, if your own teammate touches you when you're running the bases, it could be construed as interference or trying to aid him, and the umpire could basically rule you out. They wanted to, so that's why Ishikawa was yelling at Peavy to get out of his way, and shoves him out of the way, comes around, and it's not really that big of a deal because the Giants win, and there was no really any problem related to that. But here's some pictures of Jake on the field, and he's going, dude, get out of my way. Like, don't touch me. You can't touch me. And of course he hugs him. And so he totally touches him. So after this happens, the next day, there's a couple of news reports that's saying things like, for instance, this is out of New England, that Peavy ran on the field and that maybe he was a little loopy from the dental medication from his dental procedure. Who knows? And then I don't know what this is. DrBicuspid.com, this bastion of journalism, basically says dental work affects Giants player in final game. And then so I got a couple, after this is over, I got a couple of contacts. She's like, hey, what did you do to Peavy? Did you, why did you run the field? What'd you do to him? And I said, look, I didn't do anything. It turns out that he has terrible eyesight. He wasn't wearing his contacts and he didn't see what happened. He just ran on the field. So that's basically all that happened. But the moral of the story is the Giants won the They won the pennant, and then they won the World Series. And then this is me afterwards, and was able to get my World Series ring, which I have right here. Flex my ring here.
Booyah.
So yeah, that was a big highlight career-wise. Even got my name on it and everything like that. So that was quite a lot of fun. And when we were at those dental symposium meetings, this is not my hand, but this is the ring here. But a lot of these guys who have championships with their teams will kind of get together and kind of do this total nerdy flexing, ring swap. So yeah, that's just kind of fun. Here's a Cubs World Series ring. Here's the Giants one. I'm not sure what these are. But anyway, I guess that's kind of it in terms of the sports dentistry stuff. I had a few things I was going to touch on if you want to, in terms of advice. This picture doesn't even.
How do you make this?
But that's not even like. How is that advice?
You pick the picture.
All right, fair enough. Okay. Okay. So this is like a minute. It's about 3 o'clock, and I'm talking for an hour. But I'll just mention real briefly here that this is after 20 years of practice, and I could say that there is a lot of pressure, especially now when you're in dental school, when you come out of dental school, that you've got to be able to do everything. You've got to be able to do surgeries. You've got to be able to do molar root canals. You've got to be able to do really big cosmetic cases. But if you are doing things that you don't feel comfortable doing in your practice and that you don't want to do, you're going to have a pretty stressful, high anxiety career. And so there are going to be people that who are going to be able, in their practice, they do all these things, and it puts even more pressure on you. But the I guess the conventional wisdom now is that because of the way the world is, the insurance market is changing, you have to keep everything in house, and it just really isn't the case. I mean, if you do what you want to do and you're good at it, and you can offer that as a really high quality service to your patients, I mean, ideally that should be enough, and it really should be enough. If you're doing things like you're not comfortable doing, you're going to run into problems, and that's because it's going to put all kinds of stress and strain on your career. So I'm lucky to be able to say this from a 20-year veteran, but I would, do what you feel comfortable doing as a dentist. General dentist is what I should say. And you've probably heard this one before. You get out of dental school, you have all these skills, but then if you go into private practice, all of a sudden you've got to know about insurance and collecting money, and even more importantly, kind of like being a boss. And that's just something to kind of keep in mind getting into private practice. Taking over a practice from someone or starting a practice from scratch, like I did, I never really considered myself to be like a boss, but I mean, that's exactly what you have to do. You have to manage employees, manage intra-office, or I guess inter-office, employee issues. And so, these tend to take up a lot of your time and your thinking more so than does like technical dentistry, clinical dentistry. And of course, this is more apropos if you are in your own practice, as opposed to if you're working in like a group practice or clinic, or maybe like hospital dentistry or something like that. But from my vantage point, working in a private practice, it's a business, and you spend a lot of time on that part of it. But one of the great things about dentistry is you are, I work 4 days a week. I was talking to a friend of mine who is in tech around here, and he was telling me that they're trying to mandate this 12-hour rule. And I was like, well, what do you mean? He says, yeah, well, 12-hour days. We're trying to keep days at 12 hours. And I'm just like, okay, well, how does that work? Does that mean you work 12 hours a day, like but keep it a 4-day work week. And he's like, no, it's more like 6 days. So I'm just like, okay, well, I mean, that's, one great thing about dentistry is, at some point in your dental career, you're going to be able to kind of manage your own schedule. And that allows you to do other things. And, kind of like have some sanity in your life. And, I mean, it allows you to kind of spend time with your family, a lot more time with your family. And if you don't like spending time with your family,
Thanks.
you can, there's, for instance, like I'm really close to kind of getting a degree in film right now, film production. That's something that I've been kind of wanting to do when I was younger, and I've been doing it slowly. But we kind of, as a family, we've been kind of working on a film project for a number of years. Here's a still from a movie we did about cell phone addiction, which was a lot of fun. Here we are shooting a horror movie that actually got into the San Francisco International Film Festival. Here's a poster for that. This is actually Audrey in the movie. So anyway, yeah, that's it. And so we can take any questions.
Okay, first off, that was an absolutely amazing presentation. Thank you so much. That was like amazing. So we do have some questions.
Okay.
If you want to answer, if you want to spend some time.
Sure.
So our first question has to do with like the splints you mentioned, like with the injury. Like I personally didn't even know you had dental splints. And so somebody's asking, when would you use a flexible splint versus a rigid split for trauma in like sports injuries, if there is a difference?
So you're asking me, you're talking about like in the case where the young woman who played softball and they put her in a splint. Mm-hmm. Yeah. You wanted to know when we would put her in a flexible splint versus a rigid splint?
Yeah, I don't know. Somebody asked that question. Yeah. Mm-hmm.
All right.
Yeah.
I wonder if that would be a college student that's asked this question, or this maybe a dentist who's on here who maybe want to give me a hard time. So, I mean, in the case where there's say fractured bone, for instance, like the alveolus is broken and, the area is healing, I mean, it's really fragile in that area, I mean, putting someone in kind of a rigid splint it's a little bit more obtrusive. And in cases like that, you might want to use a stronger, more rigid splint when there's kind of bony tissue involved. But in cases like where like the tooth is laterally luxated, like we were looking at, you're not so worried about the tooth kind of surviving in terms of kind of being alive because you're assuming it's already dead. And a flexible splint is a little more forgiving. And so that would be a case when you want to use like more of a flexible splint.
Okay, awesome.
Yeah.
Okay, so our next question is, obviously with the team, like the team has to travel to other cities for games. Yes. Do you ever have to travel with them, or do you just do home games?
No. I don't think there's any team dentist in any sport who travels with the team, to be honest. Not even in hockey. When there are other teams visiting the Giants, say, and they have dental problems, then they would call me. They would, like, their trainer would call me. Same thing if the Giants are on the road and they're having dental issues, they're going to deal with the team dentist for whatever team that they're visiting. That's fairly commonplace, and that happens in football and basketball and hockey as well.
Awesome. Okay. Let's see. Next question has to do with like the schedule. So like obviously like baseball has, I'm not really sure when their on season is, but they have a season where they're playing. So how would your schedule look like during that time? Like when would you be doing stuff with the team and when not and stuff like that?
Yeah. Well, I mean, so my schedule really it's fairly independent from like the Giants team schedule. I mean, I don't necessarily have to hold like time open for the players. It's really more if they call me and there's an emergency. So I mean, it's like it really does not affect my schedule that much. It's even say like like when the Giants get back from spring training, would be a time when there'd be several several issues that we kind of identified in spring training. We need to deal with them when they get back. And so in that case, we might kind of create some appointment slots for some of the players. But in general, we don't have to do that. Yeah, it's just kind of like as it goes. Kind of like how you hold, in your schedule, you'll hold spaces for emergencies sometimes like every day or a few times a week. And so you would reserve, a lot of times baseball players will fit into that.
Gotcha. So kind of going off of that, like when a player does come in, what's like the protocol or procedures? Like what do you guys go through? Like I'm assuming they don't get fillings and stuff, or maybe they do, but like what's kind of that kind of procedure with them when they do come in?
Yeah, I mean, it could be any and everything. I mean, most of the stuff I deal with are not emergencies with the Giants. I mean, my sports emergencies are typically players from other teams. But with the Giants, it could be anything like, hey, I just want to come in and get cleaning, or my wife or my kids or parents want to come in. So we see a lot of families. And yeah, I've had players that said like, I want to do veneers. I want to do like cosmetic veneers. Or we have cavities, we'll do fillings. It's really anything. Yeah.
Gotcha. And then kind of going off like the mouth guards, which you had mentioned earlier, do you guys send those out to like the lab, like after making a mold, and like a lab handles that, or like how does that kind of process work with the mouth guards?
Yeah. So basically, in my practice, I don't have to make a ton of mouth guards. With the Giants, they don't. Baseball players typically, are a little more resistant to wearing them. It's not quite as high an impact of sport as say like basketball is. And so we don't have to make a lot of mouth guards. When I do, yes, we send it out. We take impressions, and depending, I'll either pour them up myself with gypsum stone and send them out to the lab, or I'll send them out to send out the impressions to the lab, and then the lab will fabricate the mouth guard. There's several, I mean, just about any general dental lab has a capability to make mouth guards. And typically is the system they use, that system I showed you that drew from that, is a pressure form system.
Yeah. Awesome. Okay, so now we have like a question for like pre-dental students, and they're just saying if a pre-dental student who is interested in sports dentistry, what kind of steps can they take right now to kind of put them in the right path for sports dentistry in the future, if that's what they're interested in?
Yeah, well, something that's really cool, well, let me see, for pre-dental students, I would say, one thing you could do is maybe during your, that's a good question. Maybe during your summers or something like that at home, or maybe even in the community where you are in college, you might want to maybe approach. I still don't know how much you'd be able to do. How much you'd be able to approach a coach of a youth team and kind of say that sports dentistry is something that you're interested in, and we want to kind of maybe help out and maybe do a presentation to some of the kids about sports dentistry or get sports injury or dental injuries in sports, because there's quite a few materials that the Academy for Sports Dentistry has that are kind of educational materials that you kind of you can kind of show to athletes to kind of help them understand what they could do to help prevent injuries. And a lot of it's around mouth guards. Students who are in dental school who are interested in sports dentistry, you can go to some of these symposiums for free. Typically, these symposiums are, I don't know, $1,200 or $1,500 for a weekend, but they definitely invite dental students to go to these symposiums to learn and to kind of learn about what's new in sports dentistry or just the basics. They give a team dentistry course, which is something that usually lasts about a day, and it talks about, and they actually give a certification in team dentistry, which, some of the organizations kind of honor that certification, but basically it talks about some of the issues you kind of run into with working with teams and your responsibilities and stuff. So there are quite a few things you can do. I would say more so once you get into dental school. But even if you're not in dental school yet, go to that website. I don't know if you can maybe repost it. Sure. That would be, because they have all kinds of stuff, information about what you can do there.
Awesome. Yeah, we will for sure repost that website for anyone interested. So when you started working for the team, was there anything that surprised you or something you didn't expect when kind of starting off with sports dentistry?
Yeah, I mean, especially when we started going down, because we didn't actually go down to Arizona for spring training for a couple of years. But when we did, it was a little bit, it was definitely interesting because, we had to kind of deal with these, Major League Baseball players, and in kind of a very kind of clinical setting and very kind of a quick kind of move guys through really quickly. And so in some regards, it could, it was a little intimidating right at first, because you've got professional personalities, shall we say. But what we found is that most of these guys are the coaches and the players are, surprisingly, they're all really nice. I mean, out of the few hundred, that we've met the last like 7-8 years, these professional athletes, on a one-on-one basis, I can't speak for their personal lives or the things they believe in, or however you want to look at it that way. But there's a lot of respect there, and 98% of them are really genuinely nice people and are happy that you're helping out, and that was kind of surprising.
Awesome.
Yeah.
Okay, so in like a typical busy week, how often do you find yourself or how much time do you see or spend in your private practice and then the team? If that makes sense. I can't.
Yeah. No, during the season, like when the Giants are home, like they're on a long homestand, there have been times when I've had to kind of work players into my schedule, even when I didn't have room for them. That's one of the arrangements I made with them. I say, hey, look, guys, as a team dentist, you can call me whenever, and if there's any issues, I'll just we'll make it work. I mean, it means I don't really like to kind of move my non-baseball player patients out of the way for them. I don't really do that, but we just make it work. And so during the season, when the Giants are at home, I might see on average maybe like 1 or 2 things a week. Sometimes it gets really busy. Sometimes we see like 6 or 7 guys, and that's happened a few times during the course of a week, in addition to our regular schedule.
Gotcha. Perfect. Our next question is, with your position, what would you say is the most stressful part and then the most fun part of being a team dentist?
Well, I mean, the funnest part for me has been kind of going down to Arizona in spring training. I mean, that's on my experience. That is really kind of a unique experience, just because we kind of go in. When I say we, I'm referring to my my hygienist, my assistant, and my wife, and we go in there and set up a little table, and we just it's almost kind of surreal, kind of being able to kind of go into this pro sports environment and kind of set up your own thing and actually be working with them. So that that's been rewarding. It's also kind of doing this thing with the Warriors, where I'm not the Warriors dentist. I just kind of help out Dr. Todd. But going to the games is kind of fun. Just kind of, it's an access thing. I mean, you got to go in underneath the stadium and kind of going back to the locker rooms. And I mean, that sort of thing has been a lot of fun for me. I mean, I kind of, that still, the effect hasn't worn off on me. Stressful things. There are a few times when you do have to deal with some personalities, when there's things that are kind of, say, like from an athlete that kind of expect something because they're used to people just giving them things and used to being treated a certain way. And when they kind of bring that mentality, it's a little hard. It's a little difficult because you don't want to be like saying, no, when you're talking about, get the hell out of here. But I mean, on the other hand, you can't let them run your practice either. But we've had to deal with a few personalities a little bit in terms of like things that they want to have done that, maybe in their lives, they're treated to things just because they're, idolized and they're given things. And maybe they kind of, it's barely a few, may expect that sort of kind of treatment from everybody, i.e. free dentistry, so that's not what we like to do.
Gotcha.
Yeah.
Totally understand. Okay, I think we have time for like 2 more questions. We don't want to take up too much of your time. But our next question kind of has to do with like your private practice. And you said you started it by yourself. And what would be like some advice for starting a private practice? And it's obviously very expensive and things maybe regarding that.
Yeah, I know the deal is different now. In terms of like the amount of loans you're going to have coming out of dental school. And I'm sure you guys know all this stuff. And in terms of like what a practice loan costs. I'm kind of out of the loop on like starting a new practice or buying an existing practice as a solo practitioner. I'm seeing a lot of people who are going in as a group these days, or people who are maybe a general dentist who's bringing in specialists to kind of help them along the way. If you got to integrate them into the practice, so you've got several people in one practice. I mean, this kind of goes counter to what I was saying about do what you want to do, but inevitably cost is going to, that's going to be the biggest factor you're kind of dealing with. And not only that, it's just that basically the way that dental insurance companies are reimbursing today, and whether or not you are in network with dental insurance companies or you're not in their networks, the amount of money that they're reimbursing across the board is less than what they're reimbursing 10 years ago. So it makes practicing dentistry more challenging. So I'm completely not answering your question at all. I'm just kind of telling you how hard it is. But I mean, I guess if I was coming out of school right now, I might consider, if I didn't have like a leg in on like a family practice or something like that, I would probably, find someone in my class, a friend who I gel with, to maybe consider going in on something together with. That's like one pathway of many, but that's one thing I might consider these days.
Awesome. Thank you for that. And I think this will be our last question. But just going back to like sports dentistry, where do you see sports dentistry going in the future? And like maybe like yourself in sports dentistry and in general, the field itself, because I don't think it's like that talked about, or it's not like as popular as like orthodontists and stuff like that.
Yeah. Yeah, I mean, I didn't even say this, but I mean, to be clear, it's not a specialty at all. I mean, you don't have to be a member of this academy to be a team dentist or a sports dentist or anything. You could just say, I'm a sports dentist, just like you can say, I'm a cosmetic dentist. I mean, it obviously helps if you have hours and hours of CE in cosmetic dentistry, if you are a member of their organizations in cosmetic dentistry to kind of market yourself as a cosmetic dentist. And the same thing goes for sports dentistry. But in terms of the future of it, I mean, it's kind of like the future of dentistry. I mean, things are getting into, scanning, scanning full arches of teeth as opposed to taking impressions is something where sports dentistry is going, because, for instance, in preseason, when you are, say, in basketball, when you have to make mouth guards for every player. Typically, you're hauling a bunch of stuff in there, and you're taking impressions. You're making molds on 25 or 30 guys, and it's a mess. And with the scanning technology, you can just scan everything in, and then, you have each player's file, and then you're done. And then you can have those models printed out, and then work off of those models to make mouth guards in-house. So that's being done. That's not brand new. That's being done. Dr. Todd does that for the Warriors. But, just like everything else, kind of streamlining, that definitely is kind of, I would say that's probably the way it's going.
Awesome. Thank you so much for the presentation, also the question and answer session. That was absolutely amazing. And I think it helped so many of our viewers. And so, yeah, thank you so much once again. Yeah.
Well, thank you guys. I mean, this was a lot of fun. I mean, this was great. I mean, I didn't, I didn't know if I was going to get everything in an hour. I thought it was taking like 2 hours, and I realized I had like 100 slides. So I was like, oh God. So thanks everybody for hanging in there who did. I'm sure we lost a few of you along the way.
All good, all good. For everyone watching, this is going to be an hour and a half session. So you'll get